Okay, so sciatica. So again, this is one of the common complaints of pregnancy or common conditions of pregnancy. There's about 10 of them, and they're all things that really regularly happen, and you can often have more than one as well, which isn't great. But sciatica is one of them, and it's caused by, and I think sometimes if you know the cause of an issue, it's easy then to sort of find a solution for it, isn't it? So with sciatica, so the biology for this is that the sciatic nerve is the biggest nerve in the body, and it goes through the pelvis. So it comes through the spinal cord and then into the pelvis and then down, kind of from the sacrum down under the bum and then all the way down, because it's this big nerve that feeds the legs and the feet and the legs. And pregnancy related sciatica is usually because the baby has decided to lodge itself on your sciatic nerve, and so it's just numbing the nerve, and then you can have dead leg. Yeah, that's a really common one. So women get just and sometimes all of a sudden as well, like they'll be walking and their leg will just, because that sciatic nerve feeds all the muscles in the leg. Yeah. So if that nerve goes, you've got nothing, you've got a dead leg. Also pins and needles, or just a pain in the leg and in the bum. It's all caused from the same thing. It's just the weight of the baby. So it can just be the weight, or it can be that they've just kind of like gone over on one side and all the weight's on one side. So what I've done with sciatica is just doing lots of big hip movements to kind of shift the baby off the sciatic nerve. So, a lot of the moves, apart from SPD, which is strengthening, but a lot of the other conditions in pregnancy are often helped by just doing loads of hip movement and just getting some space between your baby and the sciatic nerve, so that it can kind of just not go numb, not go dead. So we'll have a look at that today. And some moves are better than others, and it depends where the baby is lying on the sciatic nerve, or where the weight is. I mean, it might not be the baby lying on it. It may be just the extra weight of all the fluid and everything.
I think it is with me because I've had it for about 10 weeks. So
right.
It's not really coming here has helped, and doing the exercise has helped. But yeah, it's just always there. It feels like, so I think it's right.
Okay.
I've had like throughout the whole pregnancy, just that part of my thigh dead. I can't feel it.
Similar.
Yeah. It's really strange. But what you're saying now is probably.
Yeah. Do you remember I talked last week about the sacrum, with all the thing at the back, bone at the back with all the holes in? Well, a lot of the nerves come out of that plexus, and then if you think that is now being compressed. So it can be it doesn't have to be the sciatic nerve, it can be a different nerve. Because there's a femoral, that's an artery, femoral artery. It's probably a femoral nerve. So it can be any nerve, because they're all coming through the pelvis and down the legs.
Yeah.
Oh joy, something else.
Where my cramp comes from and all of that.
Yep. So we'll do some hip. A lot more hip movements today. Let's have a look. I think there's a few, but I can I'll add some in. So that's the sciatica. Okay, so what we're going to do today is to just kind of go through some flowing movements to kind of make space. As always, make space in the body, stretch the body out. I've got a nice relaxation at the end. Could do some pelvic girdle strengthening, and I want to introduce another birthing breath today. Is there anything else you would like?
I was just going to ask, is there anything? I've got like back pain on one side, but I don't know if it's just where I've pinched. I don't know.
It's upper back.
Upper.
Is it by your shoulder blade, your scapula? Because where you're pointing seems quite high up.
Here,
oh, there.
sort of mid.
Okay.
Maybe bra line.
Bra line. Okay. So
but
this is another thing, and it's which is like right side.
Yes.
Right side. Okay. So this might be another common condition of pregnancy, rib flaring.
Okay.
Yeah, so this is a thing. So as your baby gets bigger and bigger, there's a limit to where your baby can go down.
Yeah.
So once it's got as far down in the pelvis, in terms of like the whole of the uterus grows upwards.
Yeah.
So you know when they measure you, they measure up, don't they? They don't measure down.
Yeah.
Well, they kind of measure how low your baby's sitting in the pelvis, but actually they measure up to see where the uterus is growing. And so there comes a point when your baby pushes up against your diaphragm.
I have felt it here.
And then once that baby, it just keeps growing and keeps growing and keeps growing, pushes up against the diaphragm, and then what happens is the ribs kind of do this.
Okay.
And they flare out a little bit, and it's quite common, weirdly, for women to only get pain on one side with the rib flaring, but that's what it is. Well, that's what it's likely to be. I mean, it's a bit high for kidneys. But that's one of the things you're getting tested for anyway, because kidney infections are quite common in pregnancy.
They tested my kidneys because of giving me meds and stuff. So
so they're on top of that. But most likely when you get these pains around here, it's just because the baby's pushing.
And it's the same. I do feel a lot of pain, like not pain, but pressure in my right rib, where I think he's pushing, kicking, whatever he's doing.
Yeah.
Which is the same side as the pain in my back. So what you're saying is making sense. Yeah.
Yeah. So your baby's probably just like having a good old either using your
yeah.
diaphragm as a punch bag or kicking it or having a stretch out.
Yeah.
Yeah. I mean, they do eventually go because the body just kind of gets used to it. The body will stretch into it. But the other thing that happens is towards the end of your pregnancy, they drop.
Mm-hmm.
So there's a point, and they call it the lightening or the quickening, and it's a really nice sensation towards the end of your pregnancy, and it's usually when they get head down. So again, I want to do a little bit of work on optimum fetal positioning at some point, usually, around about 34 weeks, which I think we've got a while yet. But when the baby gets into the right position and their head slots into the pelvis, they fit really nicely, which is why it's the best position for birth. And then they drop down, and all of a sudden women go, I can breathe. You get like 2 inches more space, and it feels really comfortable, and all that aching goes away. And then you've got another 4 or 5 weeks, and they just grow again, and you kind of back to that feeling. But there is a moment towards the end of the pregnancy where there's a kind of space. Because it affects the breathing as well. The higher up the uterus goes.
I get quite a lot of shortness of breath. So yeah.
So what I think would be quite good today, actually, is thinking of working with some horizontal breathing. Yeah, horizontal breathing. So and that will fit in quite nicely with these ocean breath that I want to do as part of the birthing breaths. It's another really good one. But it's one that you can do all the time. It's really calming, so it's a good one to do, if you're just having a bad day. But it slows the breath down, so you can really work at this sort of widthways breathing. So we'll have a look at that, and hopefully it'll just kind of stretch out a little bit. And the other thing, again, is just making space for your baby. So this comes back to posture. So remember we were talking last week, if you're sitting back on your coccyx, your baby can't really go anywhere. Whereas if your pelvis is rotating slightly forwards, there's a bit more space. And also we can consciously create more space by lifting the rib cage. So notice what happens. So, when you kind of just relax as you are now, you've got that tightness. And then what I want you to do is just draw your rib cage up.
Yeah.
How's that feel?
It's better. I've noticed as well, if I do sit crouched over, I'm uncomfortable. So I'm like, I do it automatically without thinking, you just lift.
Yeah, so it's a constant thing, just that lifting, because it just gives you that little bit more space, gives your baby more space, and they stop kicking you, theoretically. Okay, so we'll have a look at that then. And how are you, Katie? All right?
Yeah, fine. Just the sciatica, really.
Right. So we'll do some leg stretches there, some hips, some leg stretches. sideways breathing, and
Bit of
then
everything.
yeah, then we'll
Mix it up.
mix it up. Okay, so coming into your comfortable seated position. So what I'm going to get you to do, Katie, is to swap your legs over, because we always sit the same way, and then our pelvis will, especially when we're pregnant, the pelvis will kind of just get used to it, and and there's a slight twist and a torque when we have our legs crossed. So when we cross the legs the other way, it often feels really odd, because we will always go the same way, but that really shows you how important it is to swap over. So I'm thinking that is going to change the landscape of your pelvis as well. So if you sit on the floor anytime at home, if you sit cross-legged at home, or even at work, if you wrap your legs around a chair, think about doing it the other way, because again, just changing what's happening in your pelvis might make a difference as well. A little difference, but maybe not, maybe more. Okay, so making sure that you are comfortable, that your pelvis is slightly rotating forward. So you might need to put something underneath your sitting bone. So as you can see, I always use a thin block, because I don't really need a thicker block, but you can use a thicker block, or roll up the edge of your cushion, roll your cushion in half. So just anything like that is going to just tip your pelvis slightly over. Yeah, that'll do it. And you kind of almost have to sit right on the edge. It's not like you're almost falling off the edge. Rather than having it all the way under your bottom, just kind of wriggle slightly forwards until your sit bones fall off the edge. And you'll know when you've got it right, because you'll go, and you'll kind of feel really kind of held and elevated. And then just roll your shoulders around and down a few times. And then let them go. So if you can turn the backs of your hands onto your legs, and notice how that changes as well, how we can breathe. It opens up the chest a little bit more so that we can breathe more easily into the shoulders. And then just take a moment. So just enjoying this time that you have carved out for yourself this evening. So just time to be with yourself, to be with your baby, but also to be with your fellow pregnant tribe. And just notice how your body feels this evening. What are all the physical changes that you might be experiencing? Noticing all the little aches and pains. So every part of our body stretches during pregnancy, and it shows up at various times during the 9 months. So you might have some subtle little niggles, or there may be quite strong ones. And then take your attention down to your baby. And just take a moment to connect in with your baby, being aware of their presence. You might feel them physically. They might be moving. And then move your attention to your breath. Be aware of your in-breath. Feel the sensation of your breath moving in through the nose. Be aware of the out-breath. Again, feeling the sensation of the breath moving out through the nose. And then just notice how your breathing is. Does it feel easy? Does it feel challenging? Is the in-breath easier than the out-breath? Is the out-breath easier than the in-breath? And just notice where your breath is going to. Where can you feel your breath moving into, in terms of which parts of the lungs, which parts of the rib cage are being active as part of your breath. And then you can just let the palms of your hands come down onto your legs. So we're going to do some circular movements. Again, these are quite good to get into the ribs. So you might need to come away from the wall a little bit there, Katie, because we're going to go round. Cassie, sorry.
It's fine.
So you might need to give yourself enough space. I think we did this last week, the kind of rolling of the chest around. So it's a nice one for the rib cage. So you're just going to move from your rib cage. Imagine your sternum is the center of this movement. You're going to push the chest over to the right, and then roll it forwards, and then all the way around to the left, and then push it all the way back. And just continue in that same way, so rolling the chest around, noticing how that feels. So there's a little bit of movement that gets into the lower back, so where we are doing these rolling movements, the lower back will be integrated as well, but we are mostly working on the thoracic spine here, which is the upper part of the back where the ribs connect. So the next time you bring the chest to the center, you're going to change direction and go the other way. And the next time you come all the way to the center, you can just rest into stillness. Okay, and then you might want to take the legs out. And we'll just do a few leg stretches. So pushing your toes away from you, and then pulling your toes back. Push your toes forwards and pull them back. Just do that a few times so you get a nice stretch in the calf muscle. And then rotate the ankles around. So again, the ankles and the feet do get quite swollen, get quite compressed during pregnancy. And then change, circle them the other way. And then just have the legs extended forwards. I'm going to turn slightly around so that the camera can see. And you might want to sit again either on your cushion or your block so that you can comfortably sit with the legs extended. And we're going to do a little bit more work into the upper body. So we're just going to do some kind of wafting movements. So you're going to reach over to the left side. Reach over to the right side. So again, this is going to work into the thoracic spine. And just reaching over and coming back. And as you develop this practice, you might find that you can get the hand all the way down to the floor. And at that time, you can just circle the arm over the head, circle it down in front of you, and then just go back to wafting. And then the next time you feel ready to go to the other side, bring the arm over and circle around. So same thing again. So we did a little bit of side bending last week and the week before, because it is one of those kind of go-to moves really for pregnancy, finding some space between you and your baby and lengthening through the side waist. So every now and again you can just reach over to the side and just do a couple more on each side. And you might find that the body is loosening up. Shoulders feel quite nice and loose now. Spine feels a little bit looser. And then come up and over. Okay, so coming back into your comfortable seated position, and we'll look at this horizontal breathing, but I want to introduce the ocean breath first as well. So this is another of our birthing breaths. And it's very similar to the heart breath. So are you doing any of your breaths like, during the day, or are they sort of coming, like we did bee breath, like you can't do the bee breath while you're at work, but you can probably sitting and harring all day anyway at work. So the ujjayi breath is really like a closed mouth version of the heart breath. And so I normally teach it from the heart breath into this ocean breath. So if we start breathing in, and then breathe out with the ha sound. And I want you to notice that it's this contraction of the vocal cords that actually creates that ha sound, and that's what we're going to use for the ocean breath. So you're going to do the same thing again, but this time halfway through your ha breath, you're going to close your mouth, but continue to do the ha sound, but you're breathing out through your nose. So it kind of internalizes the sound, but you're still going to get that slow quality of your breath, okay? So take a breath in, start with your ha, close your mouth, keep ha-ing. Okay, now what often happens is as soon as you close your mouth, the ha goes, you lose it, so you have to work at it to make sure that you don't lose it. So it usually just takes a couple of repetitions, a bit of practice. So do the same thing again. And you often know when you've got it right because it makes that same sound. When you sigh into your breath, when you cross, it's that same sound. Often goes with an eye roll. So now I'd like you to see if you can do the whole thing without the open mouth. So breathe in. That's great. I can hear it. I can hear those ocean sounds. Okay, same thing again. Breathing in and breathing out with that ocean breath. Now I want you to keep going, and whenever you feel ready, do it on the in-breath as well. You might need to do a few more rounds, just keeping that ocean breath sound on the exhale, but just leave the contraction, the constriction around your throat as you breathe in, and you'll find that you've got that sound on the in-breath as well. And so now you have this lovely oceanic sound that goes with your breath. So keep going with that, just do a few more rounds, hearing that oceanic sound. And then notice how calming and soothing this breath is. But it is also bringing more oxygen into the system because it's slowing the breath down quite considerably. So you're actually bringing more oxygen in and getting rid of more carbon dioxide. So in that sense, it's quite an energizing breath as well, and it certainly helps to keep that a really important exchange of gases in the body between yourself and your baby. So just do one more round, and then once you've finished that round, you can just let it go. And notice how the natural breath is afterwards, because often when you've done a short amount of controlled breathing, the natural breath can often just retain a little bit of that quality. Okay, all good so far? Well, Cass has gone off into meditation. This is how, in the fullness of yoga, we do these breath practices before meditation. It's all part of like the yogic, the 8 limbs they're called. But you do these breath practices, focus breathing, and then meditation comes really, really easily. Okay, so that's one of the breaths that we'll kind of integrate with some of our poses today. And again, it's a really, really good one to do. Just generally, particularly if you feel tired, you know, when that kind of like the tiredness kicks in, particularly if you're sitting a lot, which I imagine you both are at work, you know, you're sitting a lot. That in itself creates lethargy, it creates tiredness, because particularly in pregnancy, but just human beings generally, we need to move. We're not designed to sit still for 5, 6, 7 hours at a time. And so that's quite a good sort of pick-me-up to just give you a bit of a blast of oxygen, so it does kind of create that wake up sensation. Okay, now horizontal breathing. So we often think when we breathe that it's kind of it's an up and down movement, isn't it? We fill the breath up and then we empty the breath out, and there is a certain amount of that happening, but the rib cage moves out to the sides and out to the front and out to the back as well. The rib cage does lift and then it goes down, but it kind of does this and then it comes back down again. And so when you've got the rib pain, and also when you kind of run out of space to breathe, you know, when your diaphragm can't descend anymore, and then that naturally makes the breathing shorter, then we have to find new spaces to breathe into. And that's where the side ribs come in, because most of us don't utilise the side ribs when we breathe in. We're either belly breathers or it's the shoulders going up. Are you a belly breather?
Yeah, it feels especially now.
Especially now because you can't.
Yeah.
Yeah, I'm a belly breather. And so we kind of fall into these two camps. But the kind of the thoracic breath is the middle breath. And you know, I have to work quite hard at my thoracic breath. I mean, I teach, you know, yogic breathing to yoga teachers, but I have to really work hard at breathing into it. So I know about side rib breathing. So what I want you to do is put your hands on your side ribs. So it's probably round about where your bra strap is. Are you okay shoulder-wise with that? Okay. So what I want you to do is just breathe in and out and see what happens. You can do that, your ocean breath if you want to. Ujjayi breath is the Sanskrit name. You might have come across it before. Or ocean breath. Now what I want you to do is actively breathe your hands away from you. So as you breathe in, imagine you want your hands to be pushed away by your rib cage expanding. And if you're finding it difficult, then really think about engaging those muscles in the side ribs so that you can take the breath out to the sides. Okay, and then relax. So did you have no movement to start with, or just a little bit of movement to start with?
Movement.
There was?
Yeah.
So you're already using your
Doing
side
it all
ribs
day.
then?
Yeah.
Brilliant.
Yeah.
For me, there was more in my belly to begin
Yeah.
with, and then I had to concentrate to make it up here.
Yeah.
And then I didn't feel it so much here.
Yeah, and as your baby grows and grows and grows, you're going to really want this,
Yeah.
this side breath.
Yeah.
So maybe it happens naturally. Maybe your body is naturally going, I've got to find some space. And maybe that's why you're getting, maybe it's that expansion. Do you know if you're a belly breather or a chest breather? Or?
I don't know.
No, it's not something we're normally aware of unless...
But I have done yoga before, and we did a lot of chest breathing then, so maybe I just kept it. I don't know. Yeah.
Possibly.
Breathe here, then there, then yeah.
Yeah,
So,
brilliant. So you've done it already.
Yeah.
So that's good. So you're breathing in the right way. So the
if I can concentrate on it, maybe I'll do it more. Yeah.
Yeah. But so the rib pain then, it's not coming from the breath. It's probably coming from the diaphragm pushing up.
Pushing. Yeah.
So just keep lifting.
Yeah.
Make some space. Yeah. And how did that feel? The circle
That was
one?
good.
Yeah. So maybe
sometimes I just feel like I haven't got a lot of room, as in my bump gets in the way when I'm moving.
A bit like when you bend to your laces and you feel really full.
Yeah. But that's just normal, isn't it? There's
Yeah.
not a lot
you haven't got a lot of room.
No.
I mean, you know, they take a lot of space.
Yeah.
Okay, so let's do some stretching. So what I'm going to get you to do, and again, this is quite a nice one because it does give you space. So you're going to push the heels away and come into wide-legged. How are you? Are you okay with the wide-legged?
See how I get on. Yeah.
Yeah, because these are quite useful because you've got the space now.
Yes.
Okay, so we're going to do some side moves. So the ones that we've just done. So reaching over, and then as you get bigger, you can drop the hand over, and this gives you a bigger stretch now. So you can really get into the side waist. So funny, because my feet are the nearest part to the camera, I look really out of proportion. I look like I've got massive feet. And a tiny head. My feet are bigger than my head. Okay, and then coming to the centre. So bringing the hands down. If they don't reach the floor, then you can just put a block there. And then we're just going to ripple the spine. So just undulate. Imagine that your spine is like a ribbon blowing in the breeze. And just ripple the spine.
Am I doing it right?
All the way down.
Not sure.
Yeah. There's a lot of neck and head.
Yeah.
So think of it from, if you start from the base of your spine and kind of do this from the base, so from your lumbar, and then the head will just move as a result. So you're moving from the base of the body, and the head is just moving because it's attached, rather than the other way around, rather than the head doing the movements. But also this is, as you can see when we come forwards, it's stretching the hamstring, which is what I'm trying to do, to kind of just see how you feel with this stretching out of the sciatic, because the sciatic nerve goes through the hamstring. And so forward bends, which is what this is when we're bending forwards. So when we bend forwards, we stretch all down, that we're basically stretching where that sciatic nerve is going all the way down the back of the body. And sometimes it can release it and alleviate it and just make a bit of space for the sciatic nerve. And sometimes, unfortunately, it can set it off. And it's just one of those things that until you try it, you don't know what's going to happen. So we're going tentatively here, so that you've got time to go, oh no, I think that's going to trigger it. But how's it feel so far?
Better.
Yay! Great. So, excuse me. And this is quite a nice, easy one to do. You can just sit on the floor at home and do this. And it's a nice one for the back as well. It gives the back a little bit of a stretch. And like I say, bending forwards is one of those things you don't get to do a lot of when you're pregnant,
because you can't.
Because you can't. But you can when you take the legs
Yeah.
out of the way.
Yeah.
But you can only do that when you've got a nice solid ground underneath. So yeah, so that's quite a good one to do. Okay. So I think it's nice when you've had the legs out for a while to just scoop them up with your hands, because these inner ligaments, cruciate ligaments, can be a little sensitive. So leaning back and then just rock the knees from one side to the other. And that's like quite a nice release. Okay, and then you're going to come up and over onto your hands and onto your knees. So we've been doing some of these all fours practices. So again, as I said, this is like, you know, the number one pose really for birth, being on all fours or leaning over a ball. So ordinarily you'd lean over a ball in this position in birth, and then the ball would kind of roll with you and it's really nice and comfortable. But we haven't got the balls here, so we just do it on all fours. So if you're in this position thinking, well, this is really uncomfortable on my wrists and my shoulders, I don't think I can do this for 6 hours of labour, it's very different when you're on a ball, because you can just sink in to the ball and let the ball support you, and then you just move your hips, and you can be there for hours and barely know you're there. It's so comfortable. So I like to mention that because this isn't comfortable. I can do this for about 5 minutes. Okay, so we've looked at a couple of the different birthing moves. We did the making a circle, didn't we? Rolling the hips around in a circle. Did we do figure of 8 last week? I don't think we did.
I don't think so.
Okay, this is a new one. So lots of different ways of moving. Well, not lots, there's just a few different ways of moving the hips in labour. So that we did circling, so making a circle. Having something more complex to do is quite useful if your mind starts to spin out in labour. So if your mind decides, and I use my words carefully, because we are not our mind. Our mind is just another part of us. We are more than our mind. We are our consciousness. So if our mind, as an instrument, starts to panic, we can override it. So we can consciously override it by actually doing something different. And so the more kind of convoluted you make your practice, or your birthing moves, the less chance the mind has got to start getting in the way. So we draw a figure of 8. So with your right hip, you kind of make a circle in one direction, and then with your left hip, you make the circle in the other direction. So now you're drawing a figure of 8. It's a side-to-side figure of 8. Well, you can do a front and back figure of 8, so that tends to work more into the upper body, which actually we can do, because it might be a nice stretch for your back, Cassie. But we are drawing. So imagine you've got some paint on your sacrum, and as you move your sacrum around, you've got a piece of paper just above your hips, just above your back here, and you're kind of drawing the number 8 with your sacrum. Does that make sense? Yeah. And then can you use your ocean breath as well, your ujjayi breathing that we were just working with? So that's the contracted, constricted throat breath, where you have the sound of the ocean. And then just when you think you've got the rhythm, can you change direction? Go the other way. So remembering from last week, we were talking about why these hip movements are good. So they help with the contraction. So every time you have a contraction, you make these movements, you work with the breath as well, and it helps to ease the contraction. It eases the intensity of the contraction. It gives you something to do, so you're in charge, you're in control, it's not happening to you, you are working with it. And also it helps to disperse pain a little bit. Plus, being on all fours and moving your pelvis allows your baby to get into a more optimum position for the delivery, because there's more space in this position for your baby. Okay, so now you can tuck your toes under. Come and sit back on your heels, as uncomfortable as it is to stretch out toes. It doesn't matter if you can't get all the way back, and then just give the wrists a little bit of a circle. Did you notice how the movement slowed down when you started doing the breath?
Yeah.
That's
Would you do that over the ball?
Yeah. I'm wondering whether we should do the ball clasp soon, if we are.
Yes, please.
Yeah, I'll send a thingy out, because obviously everybody needs to have a ball. So we're going to come up to standing, and we'll do some hippie leggy stuff. So lift the knees up off the floor, and then just uncurl. Have a little dangle, and when you feel ready, just uncurl all the way up. I'm just going to use